Now we move to a discussion of an issue that impacts every single person living in this country, and that is healthcare. What do the American people think of our healthcare system? This is an issue that we have discussed and debated for decades in our country, and that discussion is still ongoing. And there's a new poll out that gives us an understanding of what the American people think about their healthcare system, especially in the wake of the pandemic. To discuss this issue, I'm happy to welcome back a very special guest, Dr. Jim Kahn. Dr. Kahn is a professor of health policy at the University of California at San Francisco and an editor and blogger at Health Justice Monitor. We're very happy to have him with us. Dr. Kahn, good afternoon. How are you?
I'm doing okay. Thanks for having me on.
Thank you so much for joining us. So, Dr. Kahn, I want to start by asking you a question that is perhaps a somewhat easy one for you, but a lot of viewers may not know this. What are the major differences between the American healthcare system and other healthcare systems around the world, in particular in Europe, for example?
Well, the big difference is how we pay for healthcare. In the United States, we have a highly varied patchwork of health insurance. We have a lot of people covered through private insurance, usually obtained at work. We have a wide variety of public programs such as Medicare and Medicaid and many others. And there are quite a few people, about 10%, who are uninsured. And then another major difference is that for people who are insured, the cost sharing requirements, that is deductibles, the amount of money that people need to pay at the beginning of the year before the insurance even kicks in, can be quite high, $2,000 to $5,000. Plus, there's all sorts of cost sharing even after the deductible. And so as a result, you have a variety of very different health plans. Again, some people uninsured, and the cost sharing is very substantial. This is very much in contrast to other wealthy countries, such as in Europe, Australia, many parts of Asia, where everyone is covered with a single coverage plan, a single benefit mix that's applied across the board and has very low cost sharing. This is a huge difference in day-to-day access to healthcare. Everyone has equal and excellent access.
Dr. Kahn, thank you for that summary. That's a complicated issue, and you summarized it very quickly and shortly and concisely for us, so we appreciate that. Now, moving on, what do the American people think of our healthcare system? I understand there's a new poll out about this issue. Can you give us some of the highlights?
Well, we already know from past work that Americans are dissatisfied with health insurance compared to how citizens of other countries, other wealthy countries, feel about their health insurance. There have been comparisons going on for many years. But what's new about this poll is that the level of frustration with the health system and with health care is really, really high. For example, the poll asked, how well do you think your healthcare in general is working? And more than half, 56%, say that it's working not well or not well at all. And in contrast, only 12% thought that it's working extremely well, and another 32% said that it's working somewhat well. So again, the majority are highly dissatisfied with how healthcare is working, and that's partly because doctors and nurses are stressed out these days after COVID, but it's mainly because of the insurance barriers that people have to getting healthcare. The results for other kinds of care, like mental health care and nursing homes, is even worse. People are more frustrated in those areas.
So, Doctor, can you tell us more about that, about why people have these negative feelings, and what are those insurance barriers and difficulties that have led people to experience problems and then have a negative view of our healthcare system? What are some of the issues with the insurance system?
Well, you can imagine, let's say it's January, your new coverage year, and you don't feel well. You'd like to go to the doctor, but you're still very much in the deductible period where you know that all expenses that you pay to go to the doctor, go to urgent care, go to emergency department, all of those expenses come out of your pocket. And so you do a calculation and you say, well, am I willing to spend $150 to see the doctor, possibly more with tests, maybe several $1,000s to go to the emergency department? It's like, I don't feel that sick. I think I'll tough it out. Well, that's just a terrible choice to have to make. And as a result, lots of people skip or delay care because of financial problems. And for the people who do feel like they need to see the doctor, understandably, they're sick. If you look at the rates of medical indebtedness, about half of the US adult population has medical debt. The average is $2,500. Half have medical debt. And medical bankruptcy, when the situation gets really dire financially, is extraordinarily common. It's over 700,000 per year. So you have this terrible choice of either not getting care or getting care, and because of the cost sharing, going into medical debt. And the people in medical debt, it's not just a payment they have to make every month. They're foregoing other important things like education, good housing situation, and many other things. This is a real compromise to their quality of life. And of course, then they're frustrated about how insurance has created this terrible dilemma for them. And take that for themselves and multiply it even more if it's about care for their children. Of course, people are extremely worried about care for their children. And then the psychological toll is magnified.
Now, doctor, what again? If I can ask you this off the top of my head, other people, have you ever had occasion to try to explain the American health insurance system to Europeans? And if so, are they confused when you have to explain to them copays and deductibles and caps and out of cost pockets? Because I think for many Americans, we're so used to this system, we're numb to it. But I just wonder if you were an alien from Mars learning about the system, you might go, this is indecipherable. This is insane. I don't know. Have you ever had occasion to hear what other people think of our system, trying to make sense of it?
Yeah, it's funny. I've had two types of interactions. I talk a lot to health policy experts in Europe, and they know about the problems here, so they're not surprised or confused. They just roll their eyes. They just can't believe we do it this way. They just are stunned every time. They know it. They know it's like this, and they're just stunned. But as a patient, I've had emergencies in several foreign countries where I needed to go in and get a broken toe fixed and that kind of thing. And then at the end, I go to the doctor or the business office and I say, well, how much do I owe you and how can I pay? And they look at me and they go, oh, no, it's covered. Or they say, well, there is this $20 copay that we're supposed to ask for, but it doesn't really seem worthwhile. So those are the people who are baffled that I would be, after getting care, that I would be thinking about payment issues.
That's fascinating. I was curious about that. Very fascinating. So, Dr. Kahn, next question. So, what is the solution? I understand you're a supporter of the single payer system. Tell us about that. And is there anything, given the politics in our country and the difficulty making that happen, is there anything in the short term, short of that could be done to make a bad situation less bad?
Well, I am very much a single payer supporter. And if you look at what all the other countries do, we just completed a study of 33 other wealthy countries. And every single one has universal coverage with a standard benefits package. So everyone's covered in the same way with minimal financial responsibilities for the patient. And there are other advantages, such as for doctors, like there's a single drug formulary. So they don't have to juggle all these different drug formularies. And they get paid the same for whichever patient they see. Whereas here, a doctor might get $15 for a Medicaid patient and might get $150 for a private patient. That's very confusing and distracts people from clinical care. And so single payer is the best way in the United States to get that kind of a system. Again, universal coverage with the same benefits for everyone. Public support for single payer, depending how you measure it, is about 2/3. If you ask people, would you like the government to pay for your healthcare? If it meant that you'd pay more taxes, but your premiums and deductibles and out-of-network denials and all of that would go away, everything would be paid for. You just have to pay more taxes. Then about 2/3 say that that's what they would like. Unfortunately, this kind of support isn't yet reflected in the people who are in a position to implement single payer, like our legislators. Currently, the House bill for single payer with the primary sponsor, Pramila Jayapal, has 120 co-sponsors. Not bad, but not enough to pass the bill. And Bernie, of course, has a bill in the Senate. I'm an optimist. My view is this accumulating evidence that A, people don't like the problems we have with our current insurance, and B, we continue to pay more, sometimes twice as much as other countries, will lead to a crisis that will lead to the kind of change that we deserve, which is to have a good health insurance system.
Last question for you, Dr. Kahn. Would it be possible, while that fight is going on for single payer, would something like, for example, let's say the government were to set up a fully functioning government-provided healthcare system, not in place of private insurance, but to compete with private insurance? In the short term, would that do anything to help, or does that just reinforce a bad situation?
Yeah, it doesn't work very well. That was tried to some extent under the Affordable Care Act, where there were some community options on the health insurance exchanges, but the rules that were set up under the influence of the private insurance industry were very unfavorable, and all of those plans collapsed. So it's hard to do that in a fair way, and it doesn't address the issue of terrible inefficiency and inequity. So with a separate government system, there'd be different payment rates. Everyone would have different rules. And typically poor people would continue to come out with worse quality insurance. We have Medicaid for the poor, but I just wish that we didn't have the phrase health insurance for the poor. I think everyone should have the same health insurance. The one thing I think would be a good short-term step is to go to traditional Medicare, which is a good government system, and add an out-of-pocket maximum. Right now, people in traditional Medicare are at risk of an unlimited amount of medical expenditures if they get really sick. And that would be an easy fix for the government to just say, we're going to cap that obligation. But beyond that, I think we've tried for decades to add one fix after another, including the Affordable Care Act. And they don't work because the system is fundamentally dysfunctional, it's unfair, it's inefficient. And I just don't see the point. I think it's time to do what 33 out of 33 other countries have done, is do something where everyone's covered with the same insurance, and it simplifies everything for everyone.
Dr. Kahn, I want to thank you so much for sharing your perspective, educating us about these issues, and letting us know the latest developments and what the American people are thinking about their healthcare system. Obviously, this is an issue that doesn't look like it'll be resolved overnight, so we expect to have you back on, hopefully to discuss some positive progress, God willing. Thank you so much for joining us, Dr. Kahn.
Thanks for having me on.
Thank you.